A national survey finds that nearly all Americans believe that the U.S. is right in the thick of a mental health crisis. Here to answer your questions is Dr. Manuel Pacheco, a psychiatrist at Tufts Medical Center. Good to see you, doctor.
Hey, doctor. Thanks for your time. So let's talk about these new results from the Kaiser Family Foundation. 9 out of 10 adults, 90%, it's an overwhelming majority, say that the country is experiencing a mental health crisis. Does that perception match reality? What does the data that you've seen show?
Ed and Maria, unfortunately, the perception of people does match the reality that we find ourselves in. Even before the really increased stressors during the pandemic, there weren't enough specialized inpatient psychiatric and substance use disorder beds for people or mental health clinicians to treat them. And the issue's been made worse because a lot of units have to decrease the amount of patients they can treat to maintain social distancing, and they're often closed to new admissions because of COVID outbreaks in either the patients or the staff.
And doctor, you've treated patients before COVID, after COVID, in your experience, and I don't know, I think this could be hard to measure, but you're the expert. Which mental health problems are worse now than they were before, what you're seeing?
Okay, first, thank you for calling me an expert in anything. But I think basically the two big main areas where we've seen some difficulties is substance use disorders. And hopefully we've seen the peak of opioid overdose deaths across our country. And everybody watching this story knows somebody that's either struggling currently with this problem or have unfortunately passed away. And, that's because of decreased access to treatment and increased isolation during the pandemic. For the substance use disorder crisis. And secondly, the other main areas with anxiety, and this is tightly related to the increased financial stressors and the social isolation that we're all facing in this pandemic, and also difficulties with the economy. And but I think that even though a lot of social distancing requirements have been lifted, a lot of people still don't feel comfortable gathering in large groups. And that decreases the amount of activities like sports or other social activities that usually was a big part of stress relief for them.
Doctor, you just touched on it. You said the word financial. So most of adults in the survey are worried about the cost of getting treated for mental health and whether health insurance offers enough coverage, which honestly the answer is usually no. So do you agree that's a problem?
Ed, I completely agree. And somehow more than 2 decades ago, health insurance companies and the government thought that it was a good idea to handle behavioral health and substance use disorder treatment very vastly differently than other general medical conditions. For example, if you show up to the emergency room in a mental health crisis, the clinicians evaluating you are required to go through a long and confusing process to somehow justify the necessity of emergency treatment. This is even the case, for example, when somebody comes in after attempting suicide. And it's just really disappointing. Before we go, I just wanted to remind everybody about the 988 hotline that we have 24 hours a day. If you or anybody that you care about is experiencing a mental health or a substance use crisis, please call that and get the help you need. Thank you.
I'm really glad. We're both glad that you said that. Thank you, Dr. Pacheco.
Thanks, Dr. Pacheco. Take care.
Stay well. We appreciate you. And to our viewers, if you have mental health questions that you would like our experts to answer, email them to ask@wcbb.com.